Dr. Bradshaw here with Chirocynergy. Today we're talking about a unique topic to today's world, and that is dealing with COVID-19. So, as many of us are finding out, there's a lot of information out there about masks in regards to public health, public safety, and so I'm here to give my opinion based solely on the CDC guidelines. As a doctor, my job is to take in science and data and make the best observations and the best treatments for my patients and the best practices for society as possible. So today we're going to talk about the use of masks. Of course, here in the office, when we're seeing patients, we are using masks all the time. I'm obviously here by myself today, not seeing patients, so I'm not wearing one. But in general, in the office, we are wearing masks all day long, working with patients, okay? There are a few types of masks, and I recommend that if you are working indoors, the science shows that wearing the mask significantly reduces the transmission of the virus, if you have it, into the air, recycling through and causing trouble for other coworkers and or other people, customers, patients, etc. So my opinion is, based on the CDC guidelines, wear the mask, okay? There are three different types of masks out there. There's the N95 mask, which is I don't have one with me, but it is it kind of looks like a cloth mask, but it has a ventilator gap, a ventilator piece on it that allows air to transmit in and out, and really is the best way of keeping air that you breathe out getting into the ambient air. Those masks, the research has shown, are 97% successful in reducing the transmission of the virus into other areas. I apologize for the noise. I have neighbors who are clearly doing some construction, so forgive me. The next mask out there that is recommended are the paper masks that have the elastic bands on each side and can stretch over your ears. There's a metal top edge here which you can bend to form around your nose, and that little metal wire in there helps hold over the nose pretty well. Also covers the chin. What they're finding is these masks really work best if they cover the nose on the top and the chin from the bottom, okay? And obviously on the sides with the elastic straps. So these paper masks are to be worn like this, covering the chin, covering the nose, pinching right there, okay? These masks, the research shows, 85% successful in terms of reducing and successfully reducing the transmission of the air particles and the potential of virus getting into the air, okay? That's the paper masks, okay? The last one are the cloth masks. And I'm sure you've seen a lot of people with different designs and slogans and whatever on them. It is better than not wearing one at all, okay? And that, of course, you want to make sure that you get it over the nose and it covers the mouth underneath the chin. You can see from here to here, you're covering that area. These are not quite as efficient. These are 67% successful, efficient in reducing the virus getting into the ambient air, okay? But all of these, according to the CDC guidelines and the research, are better than the .0% success rate if you don't have one on. Right now, if you're not wearing a mask, you're 100% breathing everything in your lungs out into the air that somebody else can be exposed to, okay? So it is why indoors the mask should be worn. Okay, if you're outside, if you're doing things where you're not inside, you're probably okay without wearing the mask. But science shows in these other countries where they've really done research, they had the virus before us, South Korea, China, that the recycled air in an indoor building added to or multiplied with the number of breaths that somebody is breathing out. So somebody in a gym who's huffing and puffing, somebody who's working inside, doing a lot of construction, really breathing hard and working hard, that significantly raises the amount of virus that can be put into the air and recycled to other people. If you work indoors, you really need to be wearing a mask. If you're shopping indoors, you need to be wearing a mask. That's where this virus is really transmitted, is indoors, where people are in there all day long, and there's either a lot of people and or they're breathing a lot, okay? So wear the mask. Have a great day.